So the risk of being affected by an acute lymphoblastic leukemia, or ALL, as I showed here, is actually 10 times higher if you're diagnosed with Down syndrome. Now, so I just like to remember ALL is basically a form of leukemia. Leukemia is blood cancer. Okay, now when we are dealing with complications, there's going to be 5 general categories that we're going to find complications in. Now, the first is going to be the heart. The second is going to be the GI, or the gastrointestinal. The third is going to be the endocrine. The fourth, the MSK. And 5, the neuro aspect. So the first is obviously the heart. Now, we are going to find VSD, which stands for ventricular septal defect. That's basically essentially the same thing as endocardial cushion defect. What this means is that instead of having 2 ventricles in the heart, it is actually going to be one big ventricle that isn't separated by a barrier. So it's going to be, instead of 2, 1 ventricle, one large ventricle. Now, the second thing we can find in the GI is going to be Hirschsprung's disease. Now, I will be going into further detail about Hirschsprung disease, but here's a visual of it. There is going to be intestinal atresia. Again, I will be going into further detail about it, but it is basically a duodenum atresia, which is a double bubble effect. Thirdly, there will be an imperforate anus. This basically means that the anus will actually, instead of creating its own little passageway, it'll actually tend to curve towards the other sexual organs, and it will find a different passage for secretions. Now, lastly is the annular pancreas, and this basically will take the pancreas, and instead of the pancreas being in a natural spot where it is attached to the intestine, it is actually going to wrap itself completely around it instead of being just right beside it, or fairly close to being attached to it. Now, for the endocrine, it is actually going to be hypothyroidi. For the MSK, it is adrenoaxial and instability, and for the neuro, it's going to be risk of Alzheimer's. We'll be going into more detail about the Alzheimer's and the risk of Alzheimer's that you have with it. And for neuro, which is going to be a risk of Alzheimer's, it is going to be significant drop in acetylcholine and norepinephrine. Now, there's also going to be a linear loss of memory.